Earlier today, the Department of Health released a statement that the Philippines is ready if and when the World Health Organization will lift the state of public health emergency on COVID-19. So let's test and talk about this issue. Are we positive that we can live with COVID-19 virus? Here with us today to share with his insights is Dr. Guido David, an OCTA Research Fellow. Good afternoon, sir. Thank you so much and welcome to the Manila Times. Earlier, the Department of Health says that we're ready if it is lifted. So do you agree with this statement, especially your organization, aside from the Department of Health, of course, or DOH, have been monitoring the cases, the virus in all regions in the country, not just in the capital, not just in NCR, but the rest of the country as well. So do you think we're ready?
Yeah, you're correct. We have been monitoring this for almost 3 years now. What I can say is, of course, in 2020, the initial onslaught of the virus was really bad. And then in 2021, it was still bad. We had the Delta variant and we had the Alpha and the Beta. So these were variants that were causing lower respiratory infections, and it was causing a lot of severe cases. Plus, we didn't have a lot of vaccinations in 2021. But starting 2022, something changed. After the January surge, which was Omicron, January 2022, we noticed that the hospitalizations never reached critical levels. And that's a good sign that hospitalizations don't get full anymore. After 2022, I think since January, we've already had or reached good enough level of vaccinations. I think we have about 70% of the population vaccinated. And aside from the hospitalizations not reaching critical levels, we also noticed that the extent of the waves were never bad anymore. So positivity rate may be reaching 20% in Metro Manila, and the case numbers were not as high. And I think if this is going to be the trajectory of the pandemic in the country, then we really don't have much to worry about. So what that means is, although cases are not down to zero, we still have some cases. Maybe right now we're averaging maybe around 200 cases per day. And there's a chance that we'll have another wave sometime in 2023. We don't get very large numbers just like what we did in 2021. That's one. Our hospitalizations don't exceed critical levels. That's two. And then third is that number of deaths. When we check it, it's around, right now we're maybe averaging 10 deaths per day. At some point, or last year in 2022, the average was maybe between 20 to 40 deaths per day. And this is comparable to the daily death of flu. In fact, I wrote a paper, or I'm still in the process of writing it, that the deaths for COVID is now comparable to flu death. And I think that is a good indication that we've reached, I can't say it's endemic, but we've reached a level that is almost like the level of flu, which is endemic. So those are three key points that I think shows that we're ready. And in addition to that, I think the Filipinos are ready. We have lifted our state of calamity is no longer in effect. We lifted the mask mandate, so masking is optional, but a lot of Filipinos still opt to wear face masks. I think maybe 60 to 70% of Filipinos generally wear face masks indoors. I think we know how to take care of ourselves. I think we should be okay, even if the state of emergency is lifted. Okay. Now, as a caveat to that, the only time we may be concerned is if we see a new COVID variant that is different from what we have seen over the past year. So which means that if we see a new variant in another country, which is something similar to Delta, which is causing severe illness and which escapes immunity and which is infectious, we will probably be concerned. We may have to recalibrate our strategies and our policies. But if that doesn't happen, we should be okay.
So you're saying it's green and go for the Philippines to lift the state of calamity on COVID-19. So on January 27 of this year, the World Health Organization Committee will meet to consider whether or not the COVID-19 pandemic still presents a global emergency. So if you think the Philippines is good to go, could you say the same for most of the countries, at least for the neighboring countries?
Yeah, I think most of the neighboring countries are also good to go. Most of them have already lifted their mask mandates. Japan is still having a surge right now. They have more than 100,000 cases per day. South Korea is similar to Japan, maybe 50,000 cases per day. They're testing more, but I think they know how to manage it. I mean, it's really just China that's sort of left behind. They opened up their borders. They lifted all the restrictions. Sure, they have a massive surge right now, but I think by February, that surge will be over, or basically almost over. They were the last country to really open up. And because they've opened up, I think it's easier for us in a way to move forward from the pandemic. Because if they haven't opened up, it would be difficult because we don't know what's going to happen once they open up. But because they have already opened up, then we have seen already its effects. And I think China's ready to move on from the pandemic, just be seeing it in our rear view mirror, so to speak, which means the pandemic is basically behind us now.
So the WHO, the World Health Organization, has just released a new COVID-19 guidelines. So there's 3 of them. So first and foremost is masks continue to be a key tool against COVID-19. And then after that is reduced isolation period for COVID-19 patients. And then lastly is the review of COVID-19 treatments. Do you think this is enough? Do you have something to add on this, sir?
Aside from the guidelines, we should really be reviewing the vaccines. A lot of countries have already vaccinated much of their population, but vaccination is quite slow in many African countries. So it's something that we should look into. We should have clear and transparent data about our vaccines as well. But aside from wearing face masks, we should definitely be continuing to monitor not just COVID. I mean, we really should be monitoring all these other diseases as well. And the president has initiated the setting up of CDC, the Center for Disease Control for the Philippines. And I heard that it's already passed Congress. It would really be helpful to the country to have a disease monitoring institution apart from the Department of Health. I mean, it can function with the Department of Health, just like the FDA. Disease monitoring is very important because it's not just COVID. We could be looking into tuberculosis, dengue, flu, and even the animal diseases like ASF, bird flu. What we learned over the past 3 years is monitoring is important, and our policies should be guided by science and guided by data. And I think we shouldn't look back, in terms of the progress changes we made. We should be forward looking, and we should incorporate these. In other words, we have learned from the past, from what happened during the pandemic, and we should use these nuggets of knowledge and information to help us move forward and to make the Philippines a better country.
Are there any other projects? So since we're moving on from the COVID-19 soon enough, are there any other projects that the OCTA Research is working on that we can look forward to?
Well, I'm always working on data analytic, data science, because that's my field, and mathematical modeling. OCTA Research will still be conducting quarterly surveys, gauge the pulse of the masses, the public, as far as public opinion polling is concerned. We are, I won't say in the business of, but that's what we do. Our advocacy is information. And we try to collect information and provide that to the public, to the institutions, to the businesses, to the government, and to the media, of course.
All right. Thank you so much, OCTA Research Fellow, Dr. Guido David.